Hello everyone, welcome to our channel. My name is Zetu. I am from South Africa. I am working in Saudi Arabia as a registered nurse. On our today's discussion, we would like to talk about hypertension during pregnancy. On our previous video, we did talk about hypertension, definition, the causes, and types of hypertension. But for today, we'll be concentrating on hypertension during pregnancy. During pregnancy, the body of a pregnant mother, goes through numerous changes to accommodate the growth and development of the fetus. Because of these changes, the body can also develop some medical problems, and one of the complications during pregnancy is hypertension. Who are the mothers that are at risk to develop hypertension? One, multiple pregnancy. A mother who's carrying more than one fetus, can be twins, it can be triplets, they are more likely to develop hypertension. Mothers with existing conditions like diabetes, kidney problems, immunocompromised conditions like lupus, they are more likely to develop hypertension. Previous pregnancy that the patient had hypertension, it is more likely that she can have hypertension even on the other pregnancies. In vitro fertilization, that is IVF, and those patients can develop hypertension. Age. If a mother falls pregnant after the age of 35 or above, that mother is more likely to develop hypertension. Teenage pregnancy. If somebody falls pregnant below the age of 18, they are also more likely to develop hypertension. What are the types of hypertension during pregnancy? One is gestational hypertension. This type of hypertension comes when the mother is about 20 weeks pregnant, and it goes away once the baby is delivered. Chronic hypertension. In this type of hypertension, the mother has been already having existing hypertension and has been on treatment for hypertension. Now the mother is pregnant. What is important here? The mother, once she notices that she's pregnant, she needs to see the doctor so that the treatment that she's taking to control the hypertension is checked, that is not the treatment that can affect the baby. In some cases, the treatment can be changed if the doctor feels that the treatment can affect the unborn baby. The third type is chronic hypertension with superimposed preeclampsia. On this type of hypertension, the mother is having chronic hypertension but is becoming worse during pregnancy. What usually happens, you'll find that the blood pressure is high and there is protein in the urine. Here, close monitoring of hypertension is essential. The fourth type is preeclampsia. In this type of hypertension, it's high blood pressure plus protein in the urine, and this type of blood pressure can also develop even if the baby is born, meaning that it can still be there post-delivery. What are the signs of, or symptoms rather, of hypertension? One is edema. You'll find that pregnant mother will be having edema, especially on the face, hands, and the legs. Persistent headache. That is another symptom that is common on these hypertensive mothers. Excessive weight gain is another problem. Yes, you do gain weight during the pregnancy, but it needs to be monitored. Once it's excessive, it means there is a problem. What can be done to help these mothers during this time while they are pregnant and the blood pressure is high? The mother needs to work hand in hand with the doctors or with the other health workers. Most importantly, they must be encouraged to visit the antenatal clinic more often. At times, it can be weekly, but if the hypertension is not controlled, they need to be seen maybe twice a week by the doctor or by the people that will be able to do the blood pressure and check the urine. They need to be educated to have enough rest. And when they are lying down, they must lie on the left-hand side to take the weight of the fetus away from the major blood vessels so as to improve circulation into the other organs of the body. They must know and report any changes that can happen if they are not in the hospital, especially if they feel that the fetal movement are decreased. They must report to the hospital immediately, because this can happen. You'll find that the mother has been fine. All of a sudden, the blood pressure can go right up, and that is so dangerous to the mother as well as the baby. Therefore, they must also know that they must report each and everything that they feel it's abnormal, especially with the movement of the baby. What are the complications that is caused by hypertension on the unborn baby? One of the complications will be those babies can be delivered prematurely, because if the hypertension is not controlled, especially with eclampsia that has complicated to cause seizures, if the mother develops a seizure, or if the mother goes into stroke, or if the mother goes into coma, it is important that that baby needs to be taken out, whether the child is not ready to be taken out, to save the life of the mother and try to save the life of the baby. And it does happen that if the mother is having this severe seizure or this severe coma, the mother will be rushed into theater and the baby will be taken through cesarean section. On the other hand, if the physician feel that the blood pressure is not controlled, it is always advisable that they must admit those mothers in the hospital, so that if there is any complications like seizure or complications like stroke, they will be rushed into theater because they are in the hospital. If they are not into the hospital, it can be very dangerous to the mother, and it can be very dangerous into the baby, because if they develop that stroke while they are away from the hospital, by the time they come to the hospital, it will be too late. To avoid all those complications is early admission of those patients that are having uncontrolled blood pressure, and that they are also showing that they may be having coma or stroke, so that they are in the hospital. If anything like that happen, they will be rushed into theater and the baby will be taken out. Another effect of hypertension on the baby, except with prematurity, it can be intrauterine growth retardation. Although the baby is at full term, you'll find that the baby is small. Why? Because the baby was not getting enough nutrients due to placenta insufficiency that usually happen on patients with severe hypertension. And what are the effects of hypertension on the mother herself? One of them is the danger. It can affect the kidneys. It can affect the liver. It can affect the brain, and the patient can have a stroke. And if all those things are not monitored, it can be very dangerous and it can be fatal. But with all the advancement that we're having today, the patients are admitted early and they are monitored into the hospital settings. Because what happened with severe hypertension, even if the patient has delivered, you'll find that the hypertension still needs to be monitored. And that mother, maybe who had a stroke or who had a seizure and he was rushed to theater, they usually continue with that hypertension, and you'll find that post delivery they are monitored in the ward until the hypertension is controlled. Therefore, the take home out of all this problem of hypertension is for the patient to work hand in hand with the health providers, and so that if complications do happen, everybody will be able to assist, because our main aim here is to end up with a healthy mother and a healthy baby. For today, we will end here. If you do like these short videos, please share, please comment, and please subscribe, so that we will know what we can talk about next time, to make sure that we improve our health and we also prevent the conditions that we can be able to prevent. Thank you for watching and take care.